Welcome to One on One, the Daily Items digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is Matt Myers, a Shikellamy graduate starting his residency in June, interviewed by Francis Scarcella.
Sunbury Motors Ford is coming off with their best-selling year in its 105-year history. SMC is committed to Ford Motor Company to sell 1,000 new Fords in 2020. Wow! Pick from 25 of the totally redesigned 2020 Ford Escapes, and they start as low as $21,960. Take up to $7,500 off MSRP of the all-new 2020 Ford Explorer, and they're priced from just $33,965. Sunbury Motors is Central PA's truck capital. Choose from over 120 Ford F-150s and Super Duties. Super Duty. The F-Series truck has been the #1 selling vehicle for 43 consecutive years, and SMC has them on sale for as low as $26,794. Sunbury Motors in the North 4th Street Auto Plaza, proudly serving the Susquehanna Valley's transportation needs for over a century.
Welcome to One-on-One and a special edition here with everything going on. I'm Francis Scarcella, being joined with Matt Myers, soon to be Dr. Myers, just recently graduated. Well, you're getting ready to graduate, and you're going to be getting thrown right into the mix of the coronavirus. With that being said, you've been a paramedic for how long?
8 years now.
8 years. And, well, we're going to turn it right over to you and tell us, what have you seen so far in the last month and a half?
Last month and a half, people are getting kind of scared now, seeing that there's more cases popping up within the area. A few weeks ago, we had our first case in the county as well. That kind of started to get people a little bit more concerned. Still see people out about shopping.
And you have actually dealt with someone with.
Yep. We've had a positive.
You had a positive. What are the precautions that you have to take when that?
So we've kind of changed up our process a little bit now. Whenever we are going into any patients. The 911 center, when you call into them, they have the screening process now. It's an additional set of questions they'll ask to try to help prioritize, to give us a heads up if we need to be concerned for any respiratory precautions. And it'll give us that kind of heads up. What we've been kind of doing is, with every call, we just kind of send one person in. They'll have our N95 mask on. We'll actually have these safety glasses on to go in as well with gloves. Kind of make contact with the patient about 6 feet away, ask them the same kind of screening questions again to make sure we're not dealing with someone who potentially could have the coronavirus.
If you have gowns and all that kind of stuff?
Yeah, and we'll actually gown up too if we think it's going to be a true patient that has a risk for coronavirus. There's also another face shield we put on too as well.
How has it been at the hospitals when you've gone there?
It was a little crazy in the beginning. People really had to start setting up new protocols and policies and procedures, but things have gotten really smooth. Like Geisinger is on top of it. They're very, very good.
How about for regular patients now? Is it a big difference now when you're picking up somebody that's just a regular patient?
Yeah.
And are you seeing less of that now because people are scared to go to the hospital?
Yeah, so we actually had a significant decrease in call volume since this all came out, and I think it's a good thing that people are willing to stay home. But then on the flip side too, kind of recently in the past week, I've actually taken some very, very sick people who have kind of held out till it's near the end and should have gone earlier as well.
So that's kind of a concern.
Yeah. That's what. Yeah. So if you're feeling bad, try to call your family doctor. I know some of the offices are kind of cutting hours too as well, given the pandemic. But still seek the care if you need the care, so you're not critical.
Right. So what school did you go to that you were getting ready?
So medical school, I went to Lake Erie College of Osteopathic Medicine. They're based out of Erie, but I went to the campus down in Greensburg.
So with that being said, would you have ever imagined anything like this coming into getting ready? Because you start in the UPMC ER.
Yep, UPMC Pinnacle.
When? June
19th we started.
So you're kind of getting thrown right into the mix. Have you ever imagined seeing something like this coming right out of the gates?
No, I don't think so.
And as far as training on this, has there been stuff that you've been doing to?
The school's put out some information for us to go through. The emergency medicine, American College of Emergency Physicians, they have a bunch of things they send out daily. There's some online modules to go through, videos and stuff, just kind of reviewing proper PPE, looking at kind of some of the data from China, Italy, just kind of trying to figure out treatment plans more than anything.
Are you excited?
Oh yeah, we're still excited.
You're excited to get into it and get right in the mix?
Yep.
Have you thought about going out of state to any hospitals and helping out once it gets...
So we'll be restricted to just Pennsylvania then, just based on my training license being in Pennsylvania. We were looking at the paramedic thing as well, maybe going up somewhere else, but things are starting to pick up here, so I'd rather kind of stay around here and make sure we have stuff. And then we're starting to get people who have to end up staying home, being quarantined, so we're getting short-staffed on some of the ambulances.
All right, well, we'll be right back with soon-to-be Dr. Matt Myers.
Sunbury Motors Ford is coming off with their best-selling year in its 105-year history. SMC is committed to Ford Motor Company to sell 1,000 new Fords in 2020. Wow! Pick from 25 of the totally redesigned 2020 Ford Escapes, and they start as low as $21,960. Take up to $7,500 off MSRP of the all-new 2020 Ford Explorer, and they're priced from just $33,965. Sunbury Motors is Central PA's truck capital. Choose from over 120 Ford F-150s and Super Duties. Super Duty. The F-Series truck has been the #1 selling vehicle for 43 consecutive years, and SMC has them on sale for as low as $26,794. Sunbury Motors in the North 4th Street Auto Plaza, proudly serving the Susquehanna Valley's transportation needs for over a century.
All right, we're back. Soon to be Dr. Matt Myers. I asked you to grab some stuff just to show people in case they haven't seen or just pictures. So explain what this is right here.
So this first one, this is your standard surgical mask that you have. You'd see people in the operating room wearing these. You can see them when you walk into some hospitals as well. During flu season, they're out. They ask if you have a cough to put it on so you don't cough on anybody and get the particles to you. So like we're with coronavirus for considered a droplet precaution. So if you cough droplets out, they can land on surfaces, land on people. That's how you actually can contract the virus then. If you touch that surface, then touch your face with it. By putting the face mask on, you catch the majority of the particles within the mask itself, so you're really not spreading those particles out to anybody with it. So we use these on a lot of the patients. If we're doing just kind of standard care, going into people who we think are more low risk currently, we'll actually wear these ones ourselves.
And that.
So this is the N95 mask. This one filters out about 95% of all viral particles for us. So the providers will be wearing this. You'll see people in the hospitals wearing these as well. We wear these on the ambulances as well. If we have to nebulize medications, then that aerosolizes the droplets. So now they're kind of free floating in the air. So this kind of helps to filter those out for us, so it's less risky for us as we're taking care of the patient.
Can they be reused?
Yeah, they can be. So the proper way to do it, a lot of the hospitals are cleaning them. There's UV lights, other type of processing that they do in their central sterilization to reuse them. Most places will do it they repurpose them 2 times, so you can theoretically wear it 3 times.
And they're the ones that are hard to get.
These are the ones that are hard. I mean, these are hard to get now too. Just masks in general are. But these masks, if they get soiled at all, or if we really think that that person was positive for coronavirus, we're not going to reuse them here because we don't have a way to repurpose them.
Right.
But normally we wear these for the whole day.
And then that right there.
Then we have, these are kind of our PPE kits that we set up here on the ambulance for us. Inside the kit, there's a yellow gown. It's not a sterile gown that you'd see in like an operating room at all, but it's just something. It's impermeable, so those droplets can't get through and get onto our clothes. Then we all have these safety glasses. These were donated to us here. Some of the local organizations that really appreciate that. That's great. Can't thank you enough. We have enough now where everybody has their own pair of safety glasses, which is really nice.
Right. And you're a paramedic at the Americus and the
Gillisburg, yeah, and then I run over at DHL and Sealandsburg as well. Yep, and then there's a face shield in here. I'm going to take out the plastic yet, but it goes up around your face like that, and it kind of helps to keep anything off our face as well with the eye protection. And this is another type of N95 mask as well.
So, I mean, and that's stuff that 3 months ago were never...
Yeah, we've had a few of them. I mean, we don't encounter too much stuff where we have to really wear all this type of PPE.
Right. And now before you're going out, you're suiting up on everything.
Yeah, pretty much everything anymore.
And since this all started, you see it's a constant increase daily, and I asked you before, and just explain, so you think it's going to get worse before it gets
Yeah,
worse?
so I think an important thing to look at this too while we're getting numbers back too is the tests aren't coming back daily. You can't go and get swabbed and then it comes back within a few hours. It's not like you go get blood work and it tells you that your blood count's high or normal within an hour or two that your doctor can call you on the phone. These tests are taken anywhere, some as early as 24 hours we're getting down to. I don't think those tests are out in the area yet, but they can take up to 4 or 5 days till we get results. So you're seeing people who are positive now, it's kind of 5 days ago data. So don't think that the social distancing and the stuff that we're doing as precautions isn't really working, because it is. We just have to look at it 5 days down the road with it. And we're starting to test more people now too, so there's more tests. So you're going to have more positive tests, more negative tests as well as we start to venture down that route. But the number is going to increase over the next 2 weeks.
And what's your advice as a doctor to people?
Can't give the doctor advice yet, but yeah, we'll do that. Yeah, but I mean, as far as going to the doctor, there's starting to explore more telehealth things. Medicare made it more easy, passed a few laws around where providers will actually get paid for telehealth, because in the past we couldn't bill for that, which is kind of a nice thing that came out of this. I think it's going to help people in the future too that are more bed-bound, stuck at home, that can't get to their provider's office. But call your provider. If you notice something starting to feel short of breath, starting to have problems with any of your chronic medical conditions, call them as soon as you can. Don't think that there's other sick people that are more important that you are, because you're going to become one of those sick people if you keep neglecting yourself and don't go to the hospital. And you're going to be critical and closer to the sick people.
Right. So for the people out there that are still on the fence and saying this is blown out of proportion and this is that and the other thing, what would you say to them?
It might appear that way for our area because we're very rural. So you have to look at population density as well. I mean, look at New York City. People live on top of each other, so it's very, very easy for things to be spread around. If you look up in the Northeast Pennsylvania area where a lot of people commute to New York City, that's why we have a large amount of cases up there, down in the Philadelphia area as well. I mean, it's a real thing. The mortality rate is higher than influenza. People kind of compare this to influenza all the time, and it's about 10-fold higher mortality rate than contracting the flu. So it is a real thing. I mean, I think we're fortunate right now in the area where we have a very rural area and don't have as many cases. But keep doing the precautions so we don't become as inflated as New York City or even northeastern Pennsylvania.
How long do you see this going past the end of the month?
That's hard to say. I think we're at least going to go through all of April. I wouldn't be surprised if most of May as well, until we really start to get going down on that peak.
All right. Well, thanks for joining us, and we appreciate your time.
Yeah, no problem.